Between the end of 2013 and early 2014, 3 major humanitarian crises broke out in different parts of the world. The international humanitarian system has never faced such a test on its capacities. In the Philippines on 8 November 2013, Typhoon Haiyan made landfall. In Central African Republic in December 2013, a protracted humanitarian crisis engulfed the capital city of Bangui, leaving almost a fifth of the population displaced and fully half in need of assistance. In South Sudan, in February 2014, the widespread internal conflict escalated rapidly. Fighting spread throughout the northeastern states, leaving 1.5 million people displaced. The 3 crises adopted the new L3 system-wide interagency mechanism introduced by the Transformative Agenda as part of the humanitarian program cycle. But how relevant and how effective were the responses? Were the expected results achieved? What was the level of engagement of national actors and governments? To what extent were the core humanitarian principles applied? And which areas need to be strengthened? In order to answer these questions, 3 separate evaluations were conducted on the collective response to each of the 3 humanitarian crises.
Inter-Agency Humanitarian Evaluations are indeed automatically triggered when system-wide level 3 declaration has been made. This is typically the type of thing we owe to the affected population first and foremost, but that we also owe to the donors that are supporting interagency humanitarian responses.
Despite tremendous logistical and security challenges, the humanitarian responses have saved lives, reduced the crisis' effects on health and food security, and helped to avert famine.
The interagency response, it did galvanise people very quickly, with I think over 460 people deployed within the first few weeks. Coordination structures were put in place, clean water re-established in Tacloban, roads cleared, health surveillance put in place. Also, there were some early recovery measures taken in those first few weeks, with seed distribution to farmers carried out in time for the planting season over November, December. And so those first few weeks, there was a very rapid, effective response.
The humanitarian response to the crisis in the Central African Republic managed to pull together disparate humanitarian actors into a common response, a structured response, which in itself is not an easy task. So the first thing, a structured response. Secondly, it managed to have a very positive impact on the security situation, on the protection of civilians. Thirdly, it managed to be conflict sensitive and at the local level contribute to mediation through humanitarian presence. And fourth, all the activities of the humanitarian community managed to, in some way, relieve the tension and bring in resources and basically prevent, at a number of levels, a much worse outcome and worsening of the situation.
In South Sudan, despite enormous logistical and security challenges, the evaluation found that the response was instrumental in supporting livelihoods and saving lives. For instance, an extensive and prompt public health measure contributed to controlling a cholera outbreak in 2014. However, because the fighting had led to an exodus of aid personnel, thus disrupting the agency's capacity to respond, it wasn't surprising that the evaluation found some delays in response during the first months.
the coordination mechanisms that were put in place. They were working very well in the first few weeks and helped to support coordination, particularly important at the time when the government was somewhat overwhelmed in most places in those first few weeks. But there's a very strong Filipino disaster management structure and coordination mechanism established, and the interagency response didn't really shift fast enough to support that government, that national system. So in the end then actually parallel systems evolved.
Primary responders should be reinforced rather than replaced. As such, international organizations may probably need to shift their roles, serving as standard bearers, enablers, and advocates, except for situations that require extra surge or logistical capacity.
The L3 model and the humanitarian response in a country like CAR is to go in and essentially substitute or take over the whole, in a way, provision of services. And in CAR, where the government services were not working so well and there's a lack of service provision, then the international community came in and made a huge impact.
In South Sudan, some of the key areas identified by the evaluation for strengthening include flexibility in meeting short-term needs through relief interventions, and long-term programming focused on recovery and self-sufficiency of South Sudan people. Secondly, seeking greater efficiencies, for example, through better targeting and prioritization of needs and improving interagency coordination. And thirdly, placing the affected people at the center of planning and implementation and supporting local communities and structures to the extent possible in the South Sudan context.
The L3 in the Central African Republic became something more than what it was designed to do. In the eyes of some people, it was a way of continuing to attract resources, because when you press the button of the L3, there's a surge in international resources. However, as they found in the Central African Republic, the more you extend this, it doesn't necessarily lead to continued injection of resources. So there's a sort of diminishing return to the use of the L3 mechanism. And by the end of it, it no longer brings in all these resources. And what probably is needed is some sort of a galvanizing mechanism for the recovery phase.
As a donor government, you want to help. That's why, of course, the interest is enormous in anything of coordination. That's why coordination and collective planning, response, and also, of course, then to our subject, evaluation is not an option. It's a must.
Without a doubt, evaluation has been very influential in the past and will continue to be very influential in the future in bringing about changes and improvement.
Humanitarian activities do not work in a vacuum. They work in a broader context. And in this regard, obviously, it is also important to do it as a collective effort. You have to have a common view how effective, how relevant, how efficient your program was. So it's for us key that also evaluation are a product, a joint venture, a product of a collective endeavor, and the different stakeholders, the different agencies, the different authorities are behind the evaluation.
These interagency humanitarian evaluations are extremely useful. Indeed, they look at a variety of aspects of the interagency response, and they identify areas where more work is needed.
The contexts of the IAHE were very different and difficult to compare. However, the evaluation's findings and recommendations demonstrate effectiveness in results and aim to improve the system-wide interagency work and policy decisions.